Hello and welcome to the EFN YouTube channel. This video is dedicated to the nurses' voice. EFN, which represents 3 million nurses in the EU and 6 million in Europe, through this session wants to give a direct voice to frontline nurses. The aim of this video is to tell through the nurses' voice their experience in the healthcare ecosystem post-COVID-19 pandemic. Through this video, they will themselves tell you what they experience every day and all the difficulties they face in taking care of other people. EFN wants to focus on all the key issues related to the nursing profession. Let's start with a testimony from Norway.
Yes, I'm a representative for Norwegian's Nurses Associations within the University Hospital of Oslo. The organization NSF represents over 90% of the nurses in Norway. My name is Rita Jensen, and I am an intensive care nursing. And I am responsible for the medical clinic within the hospital. I have around 700 nurses and intensive care nurses in my organization. The challenges we see is that a lot of nurses quit working as a nurse during the COVID-19. And we see that the workload is still high to do a lack of healthcare personnel, nurses in particular. There is also a lag in the patient care, especially patients' needs of surgical care. Due to the lack of specialized nurses in Norway, we are depending on specialized nurses from other countries. During the pandemic, due to closed borders and the need for healthcare providers in their home country, we need a big shortage. We still have problems getting them back after the pandemic. Norway has depended open immigrations of nurses from other Scandinavian countries for disease. This became a problem during the pandemic to the blockage of the borders. There has been an immigration of nurses from the other European countries like Spain, but there is a higher awareness now that it's an ethical way to providing for us self-knowing that there is a global shortage of nurses in the world. Norway needs to focus on educate more nurses and other healthcare providers, more focus on division of tasks, investing in technology and making the institute a better working environment for the people that work in them. In Norway, every one of fifth nurses do not work as a nurse. It's believed that the general high workload, low pay and work rotation that is harder to combine with family life. And especially after the corona, I believe that a lot of nurses just have enough. Every country needs to make themselves self-sufficient of healthcare providers and not steal from other countries that also is in a shortage. It's unethical. There need to be a higher investment in technology, and I believe that we can benefit of a closer collaborations between countries, like in research, technological development and outstanding patient care. Norway is in the top of Europe of people working in the healthcare. Around 15% of the population is working in some kind of social service. The Norwegian welfare model is based on that the government is the main provider of social service, no matter of social status, income or place of residence. Therefore, even if you live on an island, the government needs to provide for your health service and home care. As a lot of other countries, we are approaching an age wave that will give us a difficulty on providing the care that is expected to shortage of caregivers. Norway is a rich country, so they are saying that we will run out of people long before we are running out of money. As mentioned before, the government is responsible for providing the necessary health service to the populations. Nurses has a relatively high status in the community, and due to the corona, I think there is a higher awareness and appreciation for the work nurses do. In our hospital, we experience that the nurse is not represented on the leadership. The main categories of the professional neutral, but it's normal that the positions are linked to the professorship, meaning only doctors have the qualifications needed for the positions. And we experience that leadership qualities are not issued as the highest priority. Nurse leaders are leaders in lower levels and have a wider conductor span. It's normal that a nurse leader in Norway is responsible for 30 to 120 nurses. So I guess there is some work left to nurses to position themselves within the system. Other issues that we need to focus on is part-time positions, a wage that represent our worth within the system and better working conditions. There is a high demand on healthcare professionals in the private sector that is offering a higher wage, making the government positions less attractive. I believe that Europe will benefit from an equal education program of nurses, also specialized nurses. I think Europe has a lot to learn from Norway, looking at different specialized nursing, like the surgical nurses, operation nurses, anesthetic nurses, and empower their education system at the professions. A stronger control of what a nurse is set to do and what the other healthcare provision's job is. There is a lot of insecurity and skepticism that other healthcare providers will steal their jobs. And we all know there is enough for everyone, but we need to put forward a statement what only a nurse is set to do. A stronger regulations of what nurses is set to do. There is a critical need of help in the healthcare system that we do not need nurses to do. In Norway, a nurse is set to plate food, cleaning and making coffee. A nurse should use its valuable time to education's bedside focus on the patient. I believe that this is a result in a cut of the work phase. And I believe it was easier and more cost efficient to have nurses to do everything. This is not a sustainable situation now due to a world shortage of nurses. We need to educate more nurses and other healthcare providers. To do this, we need to make the professions desirable on raising the wage, focus on getting the workload down, and making a reasonable divisions of tasks.
These stories highlight all the critical issues related to the nursing profession. Nurses are the backbone of the healthcare system, and without them it risks collapsing. Thank you for following this video, and remember, nurses' voice matters.